Yes, if patient is say for every 10 minutes like that off and then on, it's your wish. Next is what? Examination of range of motion, both passive and active range. You have to check for both passive and active range of motion. If patient is conscious, if he can able to do, ask him to do some active range of motion. If patient is not good, don't go further. And if patient is unconscious, and if he is not able to do, then check for passive range of motion. Next, examination of tone. Here you can use modified Ashworth scale. You know, in clinical training 3 we had modified Ashworth scale for spasticity. Okay? For spasticity there is one scale, modified Ashworth scale. You have to use that scale, which we have already dealt in motor examination. Okay, in clinical training 3. Okay? So these are the major things which you have to examine in case of Ranko-Schloss-Amago scale level 1, 2 and 3. Now we will see the treatment. What are the goals? Physical function and level of alertness are increased. Physical function and level of alertness. Alertness means showing response to an stimuli. That is what alertness. It has to be improved. We will see how we will improve. Next what? The risk of secondary impairments to be reduced. What are the secondary impairments? Secondary impairments. Primary is muscle tone problem, postural problem and all. What are the secondary impairments? Huh? Very good. Respiratory. Next. Stiffness of joint, that is stiffness, tightness and contraction of joints. What next? Pressure sores. Deep vein thrombosis. All conditions. Stroke. Not much in Parkinson's. Stroke, traumatic brain injury, traumatic spinal cord injury, deep vein thrombosis, very important. Okay, that's a complication, secondary impairment. So better you can, so we want to reduce this risk of secondary impairment. Next, motor control is improved. Next is what? Motor control is improved.